HESI Nursing Difficult Questions. Question 1. Which term refers to the ability of the heart to initiate impulses repetitively and spontaneously? Contractility, excitability, automaticity, rhythmicity. C. Automaticity. Correct answer. The correct answer is C. Automaticity. Automaticity refers to the ability of the heart to generate electrical impulses spontaneously, without external stimulation. This allows the heart to initiate its own contractions independently of external influences. Contractility, A, refers to the ability of the heart muscle to contract in response to an electrical stimulus. Excitability, B, refers to the ability of cardiac cells to respond to an electrical stimulus. Rhythmicity, D, refers to the regularity of the heart's electrical impulses. Thus, C is the correct answer as it specifically addresses the heart's ability to generate impulses spontaneously. Question 2. What is the ability of cardiac cells to respond to an impulse by transmitting the impulse along cell membranes? Contractility, automaticity, conductivity, rhythmicity. C. Conductivity. Correct answer. The correct answer is C. Conductivity. Cardiac cells have the ability to transmit impulses along cell membranes, allowing for the coordinated contraction of the heart. Conductivity refers to this specific property of cardiac cells to propagate electrical signals. Contractility, A, refers to the ability of cardiac muscle cells to generate force during contraction. Automaticity, B, refers to the ability of cardiac cells to spontaneously generate electrical impulses. Rhythmicity, D, refers to the regularity of these electrical impulses in the heart. Conductivity is the most relevant choice as it directly addresses the transmission of impulses along cell membranes in cardiac cells. Question 3. What is the term that describes the inability of cardiac cells to respond to a new stimulus while they are still in contraction from a previous stimulus? Refractoriness, excitability, contractility, automaticity. A. Refractoriness. Correct answer. The correct answer is A. Refractoriness. Refractoriness refers to the period during which cardiac cells are unable to respond to a new stimulus while still contracting from a previous stimulus. This is essential for preventing premature restimulation and ensuring proper cardiac function. B. Excitability refers to the ability of cardiac cells to respond to a stimulus, which is the opposite of what is described in the question. C. Contractility is the ability of cardiac cells to contract in response to an electrical stimulus, not related to the inability to respond to a new stimulus during contraction. D. Automaticity is the ability of cardiac cells to spontaneously generate electrical impulses, unrelated to the inability to respond to a new stimulus during contraction. Question 4. What is the term for the amount of blood ejected by the left ventricle into the aorta per beat, determined by preload, contractility, and afterload? Stroke volume, cardiac output, and diastolic volume. Ejection fraction. A. Stroke volume. Correct answer. The correct answer is A. Stroke volume. Stroke volume is the amount of blood ejected by the left ventricle into the aorta per beat. Preload, and diastolic volume, contractility, and afterload influence stroke volume. Cardiac output, B, is the total volume of blood pumped by the heart per minute. And diastolic volume, C, is the volume of blood in the ventricle before contraction. Ejection fraction, D, is the percentage of blood ejected from the ventricle during systole. Question 5. What term refers to the degree of myocardial fiber stretch before contraction, related to the volume of blood dist ending the ventricles at the end of diastole, and determined by the amount of venous return? Preload, afterload, Contractility. Ejection fraction. A. Preload. Correct answer. Rationale. 1. Preload refers to myocardial fiber stretch before contraction. 2. It is related to the volume of blood in ventricles at end of diastole. 3. Preload is determined by the amount of venous return to the heart. 4. It influences the force of contraction and stroke volume. 5. Afterload, B, is the resistance the heart must overcome to pump blood. 6. Contractility, C, is the intrinsic strength of the heart muscle. 7. Ejection fraction, D, is the percentage of blood ejected from ventricles. Summary: preload is correct as it specifically relates to fiber stretch and volume of blood. Afterload, contractility, and ejection fraction do not directly relate to ventricular volume and venous return. Question 6. What is the amount of tension the ventricle must develop during contraction to eject blood from the left ventricle into the aorta? Afterload. Preload. Automaticity. Ejection fraction. A. Afterload. Correct answer. The correct answer is A. Afterload. Afterload refers to the amount of tension the ventricle must develop during contraction to eject blood into the aorta. It is the resistance the heart must overcome to eject blood. Preload, B, is the stretch on the heart muscle before contraction. Automaticity, C, refers to the heart's ability to generate electrical impulses. Ejection fraction, D, is the percentage of blood pumped out of the ventricle with each heartbeat. Question 7. Which neurotransmitter is released by the sympathetic nervous system, SNS, to increase heart rate and the force of contraction of the heart? Norepinephrine, epinephrine, dopamine, acetylcholine. A. Norepinephrine. Correct answer. The correct answer is A. Norepinephrine. Norepinephrine is released by the sympathetic nervous system, SNS, to increase heart rate and the force of contraction. This neurotransmitter acts on beta-1 adrenergic receptors in the heart, leading to these effects. Epinephrine, choice B, is also released by the SNS and acts similarly to norepinephrine but is not as specific for the heart's beta-1 receptors. Dopamine, choice C, primarily acts as a precursor to norepinephrine and epinephrine and does not directly increase heart rate or force of contraction. Acetylcholine, choice D, is released by the parasympathetic nervous system and decreases heart rate and the force of contraction. Question 8. What term describes the phenomenon wherein decreased BP causes a reflex SNS response with increased pulse, increased contractility, and vasoconstriction, and increased BP causes reflex vagal responses resulting in decreased heart rate and passive vasodilation in the systemic arterioles? Baroreflex. Cheney-Stokes breathing. Frank-Starling law. Starling reflex. A. Baroreflex. Correct answer. The correct answer is A. Baroreflex. The baroreflex is a physiological mechanism that helps regulate blood pressure by responding to changes in pressure. When blood pressure decreases, the baroreceptors detect this change and trigger a sympathetic nervous system, SNS, response, leading to increased heart rate, contractility, and vasoconstriction to raise blood pressure. Conversely, when blood pressure increases, the baroreceptors trigger a parasympathetic, vagal, response, resulting in decreased heart rate and vasodilation to lower blood pressure. Summary of other choices: B. Cheney-Stokes breathing is a pattern of breathing characterized by periodic waxing and waning of tidal volume. C. Frank-Starling law describes the relationship between preload and stroke volume, not the response to changes in blood pressure. D. Starling reflex is not a recognized physiological mechanism related to blood pressure regulation. Question 9. Which of the following is a central vasodilator and peripheral vasoconstrictor? Sympathetic nervous system, Parasympathetic nervous system. Norepinephrine. Acetylcholine. A. Sympathetic nervous system. Correct answer. The correct answer is A. Sympathetic nervous system. The sympathetic nervous system releases norepinephrine, which acts as a central vasodilator by dilating blood vessels in the heart and skeletal muscles. It also acts as a peripheral vasoconstrictor by constricting blood vessels in other areas to redirect blood flow to vital organs during fight or flight responses. B. Parasympathetic nervous system is incorrect as it primarily promotes rest and digestion, not vasodilation or vasoconstriction. C. Norepinephrine is incorrect as it acts as a peripheral vasoconstrictor, not a central vasodilator. D. Acetylcholine is incorrect as it primarily functions in the parasympathetic nervous system and is not associated with central vasodilation or peripheral vasoconstriction. Question 10. This is a more accurate indicator of tissue perfusion. It represents the cardiac output in terms of liters per minute per square meter of body surface area. Its normal range is 2.4 to 4 L/min. Cardiac index. Stroke volume. Ejection fraction. Cardiac output. A. Cardiac index. Correct answer. The correct answer is A. Cardiac index. Cardiac index is a more accurate indicator of tissue perfusion as it takes into account the individual's body surface area, providing a more standardized measure. It is calculated by dividing the cardiac output by body surface area. This normalization allows for a more precise assessment of tissue perfusion compared to just cardiac output alone. The normal range of cardiac index is 2.4 to 4 L/min/m²2. Summary. Choice B, stroke volume, is incorrect because it is the volume of blood pumped out by the heart with each heartbeat, not accounting for body surface area. Choice C, ejection fraction, is incorrect because it is the percentage of blood ejected from the heart's left ventricle with each heartbeat, not adjusted for body surface area. Choice D, cardiac output, is incorrect because it doesn't consider the individual's body surface area, making it less accurate in assessing tissue perfusion. Question 11. This heart condition is characterized by decreased cardiac output and tissue perfusion, which can lead to organ failure. Cardiogenic shock. Myocardial infarction. Endocarditis. Pericarditis. A. Cardiogenic shock. Correct answer. The correct answer is A. Cardiogenic shock. Cardiogenic shock is characterized by decreased cardiac output and tissue perfusion due to the heart's inability to pump effectively, leading to organ failure. This condition is a result of heart failure or myocardial infarction. Myocardial infarction, choice B, is a cause of cardiogenic shock, but not the specific condition described. Endocarditis, choice C, and pericarditis, choice D, do not directly result in decreased cardiac output and tissue perfusion leading to organ failure like cardiogenic shock does. Question 12. Which condition is characterized by an inability to effectively pump blood, leading to fluid buildup and swelling in the body? Heart failure. Cardiomyopathy. Angina. Myocarditis. A. Heart failure. Correct answer. Step 1. Heart failure is characterized by the heart's inability to effectively pump blood, leading to fluid buildup and swelling. Step 2. Cardiomyopathy is a disease of the heart muscle, which may contribute to heart failure but is not the direct cause of fluid buildup. Step 3. Angina is chest pain due to reduced blood flow to the heart, not directly related to fluid buildup. Step 4. Myocarditis is inflammation of the heart muscle, which can lead to heart failure but is not the primary cause of fluid accumulation. Summary: heart failure is the correct answer as it directly relates to the inability of the heart to pump blood effectively, leading to fluid accumulation. Cardiomyopathy, angina, and myocarditis are related to heart health but do not directly cause fluid buildup in the body. Question 13. Which valve prevents backflow of blood into the left ventricle from the aorta? Aortic valve, mitral valve, tricuspid valve, pulmonary valve. A. Aortic valve. Correct answer. The correct answer is A. Aortic valve. The aortic valve is located between the left ventricle and the aorta, preventing the backflow of blood into the left ventricle during diastole. This is essential for maintaining proper blood flow direction and preventing regurgitation. The other choices, B. Mitral valve, C. Tricuspid valve, and D. Pulmonary valve, are all located in different areas of the heart and serve different functions. The mitral valve is between the left atrium and ventricle, the tricuspid valve is between the right atrium and ventricle, and the pulmonary valve is between the right ventricle and pulmonary artery. None of these valves are responsible for preventing backflow into the left ventricle from the aorta. Question 14. What is the term for the ability of cardiac cells to respond to a stimulus by initiating a cardiac impulse? Excitability, contractility, rhythmicity, conductivity. A. Excitability. Correct answer. The correct answer is A. Excitability. Excitability refers to the ability of cardiac cells to respond to a stimulus by initiating a cardiac impulse. This process is essential for the heart to function properly. Contractility, B, is the ability of cardiac muscle to shorten forcibly when stimulated. Rhythmicity, C, refers to the heart's ability to generate a regular rhythm of contractions. Conductivity, D, is the ability of cardiac cells to transmit electrical impulses. Excitability is the most fitting term in this context as it specifically describes the response of cardiac cells to a stimulus. Question 15. What is the ability of cardiac cells to respond to an impulse by contracting? Excitability, contractility, rhythmicity, conductivity. A. Excitability. Correct answer. The correct answer is A. Excitability. Excitability refers to the ability of cardiac cells to respond to an impulse by generating an action potential and contracting. This is the fundamental property that allows the heart to beat. Contractility, B, is the ability of cardiac muscle to contract once stimulated, but it does not specifically refer to the response to an impulse. Rhythmicity, C, is the ability of cardiac cells to generate spontaneous electrical impulses, not directly related to responding to an impulse. Conductivity, D, is the ability of cardiac cells to transmit electrical impulses, not specifically related to the response of cells contracting. Question 16. What is the average cardiac output? Approximately 4 to 6 L per minute. Approximately 4 to 8 L per minute. Approximately 5 to 8 L per minute. Approximately 3 to 7 L per minute. B. Approximately 4 to 8 L per minute. Correct answer. The correct answer is B. Approximately 4 to 8 L per minute, because the average cardiac output in a healthy adult at rest is around 5 L per minute. This range of 4 to 8 L per minute encompasses the typical cardiac output values. Choice A, approximately 4 to 6 L per minute, is too narrow and excludes the upper range, while choice C, approximately 5 to 8 L per minute, is slightly broader but still within the acceptable range. Choice D, approximately 3 to 7 L per minute, is too low and does not cover the full spectrum of average cardiac output values. Question 17. What is the approximate stroke volume of the heart? Approximately 60 ml of blood per beat. Approximately 70 ml of blood per beat. Approximately 80 ml of blood per beat. Approximately 90 ml of blood per beat. B. Approximately 70 ml of blood per beat. Correct answer. The correct answer is B. Approximately 70 ml of blood per beat. The average human stroke volume is around 70 ml. This volume represents the amount of blood ejected by the left ventricle in each contraction. It is important to note that stroke volume can vary depending on factors such as age, fitness level, and cardiac health. Choices A, C, and D are incorrect because they do not align with the typical range of stroke volume in a healthy adult. Option A, 60 ml, is slightly below the average, while options C, 80 ml, and D, 90 ml, are above the typical range. Therefore, the best approximation for stroke volume in the heart is around 70 ml per beat. Question 18. This term refers to a change in the inotropic state of the muscle without a change in myocardial fiber length. Contractility, excitability, refractoriness, automaticity. A. Contractility. Correct answer. Contractility is the correct answer as it specifically refers to the ability of the heart muscle to contract with a given force without changing its length. This term is used to describe changes in the inotropic state of the muscle, which affects the strength of contraction. Excitability, refractoriness, and automaticity do not directly relate to changes in muscle contraction force without altering fiber length. Excitability is the ability of the muscle to respond to stimuli, refractoriness is the recovery period after a muscle contraction, and automaticity is the ability of certain cells to generate spontaneous electrical activity. Question 19. Which term conceptualizes that the greater the myocardial fiber stretch, within physiologic limits, the more forceful the ventricular contraction, thereby increasing stroke volume? Frank Starling's law. Automaticity. Contractility. Excitability. A. Frank Starling's law. Correct answer. The correct answer is A. Frank Starling's law. This law states that within physiologic limits, the greater the myocardial fiber stretch, the more forceful the ventricular contraction, leading to increased stroke volume. This is because increased fiber stretch results in optimal overlap of actin and myosin filaments in the sarcomeres, enhancing contractile force. Summary. B. Automaticity refers to the ability of cardiac cells to spontaneously generate electrical impulses. C. Contractility is the intrinsic ability of cardiac muscle to generate force. D. Excitability refers to the ability of cardiac cells to respond to electrical stimuli. Question 20. What are the pressure-sensitive structures located in the aortic and carotid bodies called? Baroreceptors, chemoreceptors, nociceptors, mechanoreceptors. A. Baroreceptors. Correct answer. The correct answer is A. Baroreceptors. Baroreceptors are pressure-sensitive structures that detect changes in blood pressure in the aortic and carotid bodies. They help regulate blood pressure by sending signals to the brain to adjust heart rate and blood vessel dilation. Chemoreceptors, B, detect changes in chemical composition, not pressure. Nociceptors, C, detect pain stimuli. Mechanoreceptors, D, detect mechanical stimuli, not specifically pressure changes. Therefore, the correct answer is A, as baroreceptors specifically respond to changes in blood pressure. Question 21. Which structure serves as the major chemoreceptor of the heart? Carotid body, aortic body, vagus nerve, SA node. A. Carotid body. Correct answer. The correct answer is A. Carotid body. The carotid body is the major chemoreceptor of the heart, detecting changes in oxygen levels in the blood. It sends signals via the glossopharyngeal nerve to regulate heart rate and blood pressure. The aortic body primarily monitors blood pressure, not chemoreception. The vagus nerve plays a role in regulating heart rate but is not a chemoreceptor. The SA node is the pacemaker of the heart, responsible for initiating the electrical signals for heart contraction, not chemoreception. Therefore, the carotid body is the correct choice for the major chemoreceptor of the heart. Question 22. Which of the following is a central vasoconstrictor and peripheral vasodilator? Parasympathetic nervous system, sympathetic nervous system, dopamine, epinephrine. D. Epinephrine. Correct answer. The correct answer is D. Epinephrine. Epinephrine acts as a central vasoconstrictor by constricting blood vessels in vital organs to redirect blood flow to muscles during fight or flight response. It also acts as a peripheral vasodilator by dilating blood vessels in skeletal muscles to increase oxygen delivery. Parasympathetic nervous system, A, mainly promotes relaxation. Sympathetic nervous system, B, typically causes vasoconstriction, and dopamine, C, has limited vasoactive effects. Question 23. Which neurotransmitter released by the parasympathetic nervous system can decrease heart rate? Acetylcholine, norepinephrine, dopamine, serotonin. A. Acetylcholine. Correct answer. The correct answer is A. Acetylcholine. Acetylcholine is released by the parasympathetic nervous system and acts on the heart to decrease heart rate. It binds to muscarinic receptors in the heart, leading to a decrease in heart rate through inhibition of the SA node. Norepinephrine, B, is released by the sympathetic nervous system and increases heart rate. Dopamine, C, and serotonin, D, are not directly involved in regulating heart rate through the parasympathetic pathway. Question 24. What is the ability of cardiac cells to generate an electrical impulse without being stimulated by an external source? Automaticity, contractility, conductivity, refractoriness. A. Automaticity. Correct answer. Automaticity is the ability of cardiac cells to generate an electrical impulse spontaneously without external stimulation. It is a fundamental property of specialized cardiac cells like pacemaker cells. Contractility refers to the ability of muscle cells to contract in response to an electrical stimulus. Conductivity is the ability of cardiac cells to transmit electrical impulses. Refractoriness is the period during which cardiac cells are unable to respond to a new stimulus. Therefore, in this context, the correct answer is A. Automaticity. Question 25. Which heart chamber receives oxygenated blood from the lungs and pumps it to the rest of the body? Left atrium, right atrium, left ventricle, right ventricle. C. Left ventricle. Correct answer. The correct answer is C. The left ventricle. The left ventricle receives oxygenated blood from the lungs through the left atrium and pumps it to the rest of the body via the aorta. This chamber has thicker muscular walls compared to the right ventricle to generate enough force to propel blood throughout the body. The left atrium receives oxygenated blood from the lungs but does not pump blood out to the body. The right atrium receives deoxygenated blood from the body and sends it to the right ventricle, which then pumps it to the lungs for oxygenation. Therefore, choices A, B, and D are incorrect as they do not accurately describe the function of the heart chamber that receives oxygenated blood from the lungs and pumps it to the rest of the body.